Has your doctor ever looked you in the eye and said, your symptoms are normal and you're just getting older? That sentence may have cost you years of feeling normal and like yourself. In the next few minutes, I'm going to break down the top 5 things I wish women over 40 knew about their hormones. Some of these things might be surprising, some make you feel a little angry, but by the time we're done, you're going to know exactly what to do. Have you suffered from fatigue, you can't sleep, and brain fog, and you keep trying to push through? Your symptoms progress, and you really start thinking, okay, this is how I'm going to be or continue to get worse. And it can be concerning and scary, but you really start accepting it. My name is Sharon Lemoyne, nurse practitioner, 28 years in medicine, 8 years now with a medical clinic with a focus on faith-based medicine and functional medicine, hormone optimization, and overall health and wellness. I'm going to walk you through the 5 top things that nobody is telling you about your health and hormones. When we're done, you might be a little frustrated at first, but you're going to know exactly what to do. Number 1, your hormones started declining years before you felt it. When we talk about hormone imbalance, typically we're talking about estrogen, progesterone, and testosterone. There are many layers to your health. And later on, we're going to talk about thyroid and vitamin deficiencies. But let's focus on hormones right now. When you start going through perimenopause, which is usually for some women early to mid-30s, and this can last 10 years prior to actually hitting menopause. Testosterone, for instance, we start losing right around the age 30, and we're losing up to 1 to 4% a year. So fast forward a decade, you're definitely going to feel that. Estrogen and progesterone also can fluctuate through perimenopause, and when you hit menopause, they have slowly declined to minimal values. The majority of women coming into my office typically are the range of 30 to 60. They have a wide variety of symptoms, and almost every single one of them are so frustrated and looking for validation because they have been dismissed by their doctor. They were told by their providers their labs were normal and everything was fine. Think about your hormones like a car. You're not going to let the car run out of gas until you fill it up again. Same thing with our hormones. We don't want those hormone levels completely depleted before we start looking at symptoms and how to treat before that gas tank runs empty. If you're in your mid-30s and you're having exhaustion, sleep, irritability, low libido, brain fog, weight gain, don't dismiss this. Don't accept it that this is just life or just getting old. There is a true reason why you are feeling like this, and we are here to help. Even if you go into your provider and you ask for detailed labs and everything is normal, don't accept that there are no treatment options, which brings me to point number 2. Normal labs are keeping patients sick. So let's break this down. When we get our blood work done, there's always a normal range for each lab. So how they get this is they take a big section of patients or a big group of healthy patients. They do the specific blood work and they find where everybody is averaging and they call that normal. Now, for each person, science is not perfect. Everybody is different. So if we're looking specifically, let's say testosterone in women, the average range for women on the blood work is 4 to 50. Now, are you 18 or are you 80? Number 1, they need to account for that. So this is a very wide range to capture everyone. If I feel good at 50, but my patient feels horrible at 50, that tells me that, again, this is not an exact science, and I can't call normal if my patient is feeling horrible. Symptoms of low testosterone, irritability, anxiety, depression, night sweats, sleep disorder. So again, if my patient's coming in, their labs are normal, we need to think there's more work to be done. Let me be clear. Normal is not optimal. And most women over 35, 40 years old are all suffering, and we need to listen. I cannot count thousands of women that I have seen that have had some basic labs, been told they're normal, and they come see me. When we start diving a little bit deeper into their blood work, for instance, thyroid, instead of just looking at a TSH, I'm going to look at a T4, a T3, and antibodies. That gives me a broader picture, right? We're looking at estrogen, progesterone, free testosterone, total testosterone, sex hormone binding globulin, all the vitamin deficiencies. Again, normal is not optimal. Imagine your car starts sputtering and you take it to the mechanic and they look at just the oil tank and say, you know what, you're a third full or you're a quarter full. It looks good. We're going to go ahead and call it normal and you're going to go home thinking, okay, my car's still sputtering. They didn't look at the spark plugs. They didn't look at the transmission fluid. They gave just a very quick look at one thing, didn't look at the whole picture, and now your car is not acting correctly. Again, for you, we cannot just look at one lab. There are many, many layers, and we need to consider the big picture to find the right treatment plan for you. The next time you get your blood work done, write down the specific labs you want, know the ranges, ask your provider, can you do these labs? And even if they're normal, are you willing to have that conversation to still treat some of my symptoms? If they say no, then that can be a red flag. If they say yes, that is your person and you have just started a relationship with somebody that's going to take your health seriously. Now, here's my third point. And when we talk about it, some people get a little emotional. So if you're sitting here watching this video and you're thinking, why has nobody explained this in this manner or in this detail? Hit subscribe. There are more videos with more explanations on this topic. Point number 3, the rage, the irritability, the anxiety. This truly could be because of a hormone disruption. With testosterone, that is for motivation and really wanting to kind of get up and give us some zest for life. Estrogen, as that declines, lowers serotonin. Progesterone is a calming hormone. It also helps us sleep. So as those symptoms slowly progress, we have to consider each of those hormones and the fluctuations and how we can simply treat those versus being put on an anti-anxiety medication or an SSRI. Now, again, sometimes medicines are required, but let's look at the root cause first. Let's treat the hormones, let's optimize and see if we can avoid a medication that most of the time does not work and has a lot of side effects. I have seen thousands of women coming in that have discussed this with their primary care provider, and they talk about their anxiety and depression, and they are handed a prescription for an anti-anxiety or antidepressant. They try it and they do not feel better. Some of the symptoms they're experiencing is brain fog, fatigue, low libido, and after taking the medications, they don't feel any improvement because the issue was not addressed. They need either estrogen, progesterone, testosterone, or a combination or all three to really fix the issue. Ask yourself, have you had sleep issues, night sweats, low libido, weight gain, fatigue? If you've had 2 or 3 of these symptoms and you have a lot of the mental issue concerns, you have to think maybe this is hormones and not a true mental issue problem. Which brings me to point number 4. When you are told you are just getting older, this is not a diagnosis. This is a dismissal. It's not addressing the issue. It's sending you out the door without any answers, and you continue suffering. The truth is, when we are looking at hormone replacement, hormone optimization, you really have to understand a true depth of what hormones are, how you should be treated. And in the medical industry, this is not something that is taught to providers. And here's my take. Providers have the best intentions, but if they've not had in-depth training on hormone optimization, how can you expect that they're going to give you the answers that you're looking for? Now, there is a big movement in menopause education right now, and I think the future is looking brighter to give providers a little bit more education and shed the light on the need of patients when it comes to perimenopause and menopausal symptoms and treatment options. I have spoken with many patients who have seen their providers, and I've also talked to providers that have sent me patients because they truly do not know in depth how to manage these symptoms. So when I say that you deserve somebody that's had specific training, no, this is not the standard in our medical industry. Again, as you all know, I'm not a big fan of corporate healthcare. And I think there's a lot of flaws to this. Our medical education is funded by big pharma. And here's the question. So are sick people going to make money or lose money? Okay. If we keep you healthier, your hormones optimized, not only are we making you feel better now, we're preventing disease down the road. Here is what I would like you to do. Stop Googling your symptoms at 2 a.m. Here's the thing, I've done it too. Even as a provider, I thought, oh my gosh, what is happening to me? What I want you to do is make a list of all of your symptoms. When did they start? How debilitating are they? Are they progressive? And I want you to find a provider where you can sit down, discuss your symptoms, ask for a detailed blood workup. And if they're willing to have that conversation, great. You found a good person that's going to go in depth with your hormone levels. If not, you need to find somebody that's going to give you the time that you deserve. And this brings me to the last point that I think changes everything. The biggest lie in healthcare is that your health just happens to you. And if I don't get anything else across to you, I want you to know you are in control of your health. The system that we live in today is designed to treat symptoms. It's not designed to actually heal the patient. A perfect example. Think about how many people you know or yourself have been diagnosed with high blood pressure. So you go to your provider and they hand you a prescription. Do you have a conversation about lowering your salt intake, doing some modifications to lifestyle, becoming a little more active, watching that diet, figuring out how to lower your stress? And ultimately, if you can correct your hypertension, you're not going to need that medication. Same thought with type 2 diabetes. If you go in and you have an elevated A1C or show some insulin resistance, the first option in our traditional healthcare system is offering medicine. Again, that conversation should be that you are in control. You can turn things around by making some lifestyle changes and actually reverse type 2 diabetes. Look, medicine sometimes is a necessity. I'm not saying that you never have to take any kind of medication, but I'm saying we should exhaust every option and make every lifestyle change first. And then if we have to rely on medication, then of course it is there. But let's not miss the point. Again, you are in control. At the age of 31, I was working as a nurse in emergency medicine, and I was diagnosed as a type 1 diabetic out of the blue. Always lived a healthy lifestyle, and so it was quite a shock. I soon started running with a few nurses that I worked with, thinking I've got to find a way to really feel like I can control my health. And 13 months after my diagnosis, I ran a marathon. And let me tell you, during that race, it was one of the toughest things I've done. But my mantra was, you are in control. You are in control. And when I crossed that finish line, I realized that I had a long life ahead of me, and my health was up to me and how I choose to control it. And running actually became very therapeutic. The truth is, I want you to walk away feeling empowered. I want you to understand that your provider is there to hold your hand, give you the tools. They cannot do the work for you. So please understand that we are here to give you the information, give you our medical opinion, look at hormones, look at the root cause of what's causing your symptoms and help you heal. But ultimately, you have to make that choice and you are the one in control. Okay, so tonight, before you go to bed, I want you to write down the top 5 symptoms that you have been experiencing. When did they start? How progressive have they been? And I want you to take this to your next doctor's appointment. Have that discussion about your symptoms and how significant they have become. Ask for detailed blood work and exactly what your provider plans to look at. If they are open to the conversation, you know you're in good hands. If not, that could be a red flag. You are not broken. You are not crazy. Most importantly, you need to acknowledge your symptoms, understand them, and know that there is a plan to help you heal and be validated. The first step is realizing you deserve answers, not excuses. If this video has opened your eyes, stay tuned. The next video is coming up, and we discuss the top reasons women over 40 feel exhausted. That video is on the screen right now. Description is below, and I'll see you in the next video.